Namaste everyone. Today we'll be dealing with the contact. We are discussing about the occupational stress, how we will be handling it. This is actually at the situation where competition, excellence, the way we strive to be what we are is rising very much. And even in India, there are situations where people commit suicides, people resort to situations like drug abuse, everything to handle occupational stress. And this is where a comprehensive management to handle the stress in an Ayurvedic mental healthcare perspective becomes very essential. So, handling the occupational stress requires two important things. How is the way we take up the stress and how is our body responding? We cannot change the system which creates the stress. What we can do is change the way how we respond to the stress. Typical level of stress is very essential for a person to become successful in life. It is called as eustress or the positive stress. This makes you leap or do the things very actively and become more productive. And this stress in a particular optimum level maintenance makes a person overcome to a higher level of confidence. But when this is exceeding, it becomes a disorder of stress management. The proper level of stress, if you perceive in a proper way, makes you successful and makes you prepare well for the things which are there in your life. But when it is exceeding, it becomes increased to a stage called as psychosomatic disorders. The psychosomatic disorders are things which are occurring where the stress is affecting the physic or where the physical symptoms are aggravated by the stress response in our body. So, what are the main things which we handle in our OPDs are usually headaches, the low back aches, the situations of sleeplessness, gastrointestinal disorders. All these things will be having a root cause of psychosomatic issue of stress, either occupational or personal. So, treating headaches, treating gastrointestinal disorders always requires an inquiry into what the patient's occupation is, what is the ambience in the workplace, and how is his physique responding to it based on his sleep, activities, and everything. High level of occupational stress reduces a person's workability and the way he is creative in his workplace. So, the first thing which he will be having issues with is meeting the targets or creating any level of time management and time planning regarding the work. So, what makes a person worry about the deadlines? What makes a person laggish till the last moment? It is because he is not able to have a proper focus of the brain regarding the work, his time, and his ability to plan accordingly. So it is a brain function as being lacking to meet the target. So we should do the first thing is to help the patient relax physically in either the medication level or the meditation or other methods to relax, think properly, prioritize his work and meet the targets. So the next thing which usually people have in work occupational stress is the workload. The target or the load of work may not be able to be completed by a person. So how does this happen? Usually we will be having an issue with our ability enhancement and also proper level of communicating our assertive skill, like which work which we can do at the proper time. Saying a proper no without hurting another person is an emotional intelligence. That is also a skill required by the people in an occupationally happy environment. So, emotional intelligence is an essential thing in managing occupational stress, where a person will be able to communicate what I can do to the maximum and the which load of work I can take up, and the next set where we can listen to our teammates. So, this emotional intelligence can be also a byproduct of our internal prakriti or the personality. The first question is the aptitude towards job. Why do we have a job or why do we go for a job? At most of them, it can be because of an income, it can be for the happiness, it can be for living. But for few, there will be other reasons for a job. It can be his self esteem. He feels a boredom to fill the boredom. And most often, when a person enjoys the job satisfaction will be the reason for the job. So, if you enjoy the work which you are doing, if you have a pleasant attitude towards the thing, then the real issue of the job can be handled as a work life balance. So, how do we balance the work and the life? We will be able to set boundaries where to limit the work to a personal space of the life. So, where the life can be qualitative. So, if your mind is okay, if your body is okay, if you're disease free, if you are resilient enough, that is the phrase which we say for stress handling ability of a person. Then, so the resilience of a person increases if the life quality is improved. So, what Ayurveda helps in a person to handle the occupational stress will be to balance this work life in a way of improving the resilience. The resilience improvement is basically due to ability of body better well-being, and this helps a person manage the workload, reduce the stress, and do a multitasking way. So, is multitasking a thing which is tiresome in our body? So, this is a usual question, and what the real answer, what we explain is in Ayurveda, we explain a thing can be done only at a one time, but at that time, we should enjoy at the same moment. If you are drinking a sip of tea, you will be taking the tea taste alone by the brain, and the second fraction, you might be reading the newspaper. At that time, we are not tasting the tea. So your brain is focused in one work at a time. But if you are enjoying each moment, you will be able to do the task in a higher level. So mindful activity of all micro actions which you do with the proper balance of the body is the key answer for resilience improvement or stress management in occupational arena. So, usually in a hierarchy of occupation, there will be the first thing which is hurting a person as corrections. Person will have to face corrections from the hierarchy, from higher officials, from people who are around him, or even from a situation of subordinates. A person might point their blame upon us. So, how do we take in the correction? These corrections are creating the stress to an individual in most of the occupational areas. So, it is the prakriti or the personality of a person which determines how I am responding to a correction which the system offers towards me. When a boss or a person who is higher official towards me makes a correction towards my character or my profession or my activities which I have done, how do I take it is determined on the prakriti or the personality dominance of my person. So, a person, usually we have Vata dominant Prakriti, Pitta dominant Prakriti, and Kapha dominant Prakriti. So, if a person is Vata dominant Prakriti, usually the emotional status of the Vata dominant Prakriti can be two extremes. They become emotional liable. It's not anger, it's usually the sadness which becomes more evident for a Vata dominant person. So, a Vada dominant mind usually have an attitude of overthinking. So, when a correction is given to a Vada dominant Prakriti person, he will have an over analysis of his guilt activity. There is a possibility of over guilt. There is a possibility of over emotional liability and self blame in that situation. So, if it is a Pitta dominant Prakriti, the most important feature will be the response. So, when a person is Pitta dominant person gets the correction, what he will feel is hatred. Why am I personalized response? Why am I being targeted? He becomes angry within. He will not think rationally. So, a person, the third type is the Kapha dominant Prakriti. The Kapha dominant person, if it is vulnerable, he will be ignorant regarding the correction. I have a subordinate whom whenever we give corrections, He will listen to me. He will listen to me very obediently. We will have a face that he is listening, but his correction will not be there. So Kapha has an Ajnana face. So that Kapha state, if the Prakriti is high, the person may not have a correction mode and he will repeat the errors in a repeated way. So, acceptance of correction is seen in few persons. In such cases, there will be balance between the doshas in a personality. Though there might be having a dominance of Vata, the person will be aware that, okay, I am a Vata dominant person. So, I should balance the Pitta Kapha. So, my personality is proper. So, such an evolved person will be having acceptance of correction in a occupational system. So, understanding a person's prakriti, understanding a teammate's prakriti is very essential for a happy occupational system. Because if you know the how the person will respond, how the person will internalize the correction, we will be able to make the correction easily. So, we can do a self evolution. At the same time, we can modify our corrections for our subordinates by understanding the prakriti. So, acceptance of correction is mainly based on the Prakriti, but the response of that Prakriti is mainly based on the Manodosha, which is very high in that moment in that person. So, the Manodoshas are usually Rajas and Tamas, and balance of this Rajas and Tamas is a state of Sattva Guna. Here, the Rajas is an active principle which makes you more responsive, like an impulsivity, anger, violence, or more level of expressed emotions are complained by the Rajas. But whereas tamas is a stage where you will be having very much negative attitudes. It can be self-blame, very level of sluggishness. So ajnana level of kaba is influencing the tamas. So tamas, if it is in a balanced stage, a person on hearing the correction will be able to respond in a minor level. So Rajas Tamas balance is required to have a sattva functioning where a person becomes obedient. So this manodosha management is also a methodology which we do through the correction of Sarira dosha of Vata, Pitta and Kapha. So, in an Ayurveda treatment, we will be correcting the body, the mind, and through that, the behavior will be altered. So, it's a triangle level of application where the result is seen in behavior and the thoughts. So, if we need to make a correction for that, there are various supportive measures also. Other than the body methods, the supportive measures includes measures like dinacharya, where the circadian rhythm of a person is corrected. So, correcting the body begins from scheduling the body. The time which we get up, the level of self control which we have regarding our lifestyle, everything falls under dinacharya. So, this body correction through the lifestyle modification of the day determines how confident you are regarding your daytime activities. So the thing is next is the mind correction. There are various psychological methods to correct the aptitude of a person through the measures called as sattva avajaya, or where we build in the resilience of a person. So the Sattva Vijaya or the psychotherapy measures exclusive for Ayurveda in mainly correcting the cognitive methods and also alters the overt behavior. So the way you think, the way you behave. So correcting the thoughts will be helping your behavior modification. And also how your behavior is modified the same way you think. So it's a by-way action where thoughts are corrected at the same time, behavior is altered. So there are various measures for them. So the next thing will be our main activity of our behavior is the nidra. Nidra is the rejuvenating aspect of sleep hygiene, which is very essential, especially in handling occupational stress. Nidra or the sleep helps us brain active in the frontal lobe activity areas. And this nidra is called as Bhudadatri. It's the one which supports you just like your mother. So that level of sleep hygiene measures are very much oriented in an Ayurveda to reduce the stress level. So when the sleep is corrected, the other thing is vihara correction. Usually the activities which we schedule are oriented on cheshta, ajara and vihara. They are oriented upon social well-being and often individual. We have an attitude of an individual growing with the society in an Ayurveda where a social health is also focused. So there are acharas which we emphasize the patients to do. Acharas can be culture-specific activities which gives a person a bonding with the society where he belongs. So these culture-specific activities, when being corrected, the cheshta and vihara or the movement, psychomotor activities. Cheshta is the psychomotor activities. Psychomotor activities become very much balanced, and a person will have even a hormonal level. We have social bondings, social level of interaction. The level of stress hormones within the body will be very less. So, in treatment of psychotherapy, the first thing which we used to say is in doshobakrama. The first thing is you should have a proper connection where suhud banda. That means if the friendly circle should be there with the patient. So, what you hear, if it is pleasant, your thoughts will be very pleasant. If you are isolated in an area without interpersonal relationship, your thoughts will be over exceeding. So, in all the treatment of dosha management, such type of social connectivities are very much emphasized. So the next is the ahara correction. The food and mind has a very good relation and very detailed explanation for the way to consume the food, the place to consume the food, and also like the etiquettes, how it can be pleasant for the mind is also explained in Ayurveda in stress management. So, in a summary, how does this act? We have an Ayurveda psychiatry for three branches. The first is called as Yukti Vipasraya, the second is Sattva Avajaya, and the third is Deva Vipasraya. So, this is the three branches of every treatment in Ayurveda. So, Yukti Vipasraya is a medicine oriented, logic oriented treatment. Yukti means the logic, and the doctor logically analyzes the situation, logically finds the permutation of medicines for the patient, and applies it for the patient's condition. That is Yukti Vipasraya treatment. Second is the Sattva Vijaya, which we have seen recently, where the mental health is improved by various measures of psychotherapy as well as psychological interventions. The third is the Deva Vipasraya. Deva is an unseen power, so it can be the belief system of a person. The belief system should be enhanced in case of mental health issues. So, whatever be the person's belief, that is enhanced, and that area of treatment is called as Deva Vipasraya. So these three synchronized attitude will be also applied even in minor cases of stress management or even in higher levels of mental health disorders or even in general health management of diseases. So the treatment is both a pharmacological as well as non-pharmacological. It's a sync between these two. So, where the clarity of body obviously is affecting the clarity of mind. It's just like an osmosis. How one is clear, the other one becomes clear. And the clarity of mind will be also affecting the body. So, body level treatment will be given for purification. At the same time, mind level of thought purification through the sensory corrections will be also given. So, in Yukti Vibhasya, this is the one which we will be discussing on the main sessions of the classes. Yukti Vibhasya or Ayurveda treatment modalities based on medicines will be discussed more in the sessions. So, this Yukti Vibhasya is basically of two modalities. The first one is called as Samshodhana, and the second one is called as Upashamana. So, even in stress management conditions of occupational stress or in situations where a person is too much stressed, there also we might be requiring a samshodhana where the body is becoming pure. or the purificatory measures can be adopted in a minor level. So the other one will be the Upashamana measures, where the Upashamana or the pacificatory measures can be external measures and or the internal medicines which we provide for the patient. Samshodhana prevents the recurrence of the situation and Upashamana gives a symptomatic relief for the patient. So, as we have seen, the correction of Upashamana will be also lifestyle based, where Ahara has to be corrected, where the food is correcting on the gut brain axis. So, we have an enteric nervous system which is working from the brain towards the gut. This is corrected on an Ahara domain. We have a higher level of microbiota or a good column of microbiota in our gut, which will be producing hormones which reduces the stress. So this microbiota is in the way connected through the gut treatments which we do in Ayurveda. So the dosha correction is there. At the same time, the physiology correction is also occurring in a methodology of treatment adopted. So the brain activity will become in an ambient level where the hormonal system is also enhanced. Self hormones are also more produced, which reduces the stress. So the second is the nidra, which we do for upashamana. So the sleep, as I've said, is becoming a rasayana or the rejuvenation for the patient. So what do we do for enhancing a person's sleep? The first thing can be measures which is there in lifestyle at the time of food intake, the gadget usage, the ambience of the sleep, and his scheduling of the day. So, at what time his physical activity? There are people who do late night exercises. So, whenever there is a late night exercise, body is becoming more active again, and the pitta is very high, vata is very high after activity, and if he tries for a sleep, at times he won't be able to get his sleep because the body is still active. We need a tiresome phase for the sleep. So the time of activity is also altering the sleep. So optimum level of vyayama or physical activity at the optimum time of a person is very essential for even maintaining nidra. So the nerve cells become more replenished with the proper sleep and also a proper exercises. So this balance is to be maintained with proper quality of food. So this is a tripod where food, exercise and sleep is maintained to optimize the stress level in eustress condition. So the upashamana, when it is mainly based on these things, the correction of the Upashodhana treatments are mainly oriented in correcting the Agni and Ama. So that is the metabolism of our body. So when you do Shodhana procedures, the metabolism is corrected, the Agni is improved, and metabolic errors correction helps in more absorption, or the Rasa formation or the Dhatu formation is enhanced in our body. The clarity in Rasa Dhatu helps in forming the subsequent Dhatus, and the state of ojas or the well-being of a person without stress is enhanced only if a person has clarity in Rasa Dhatu. If we see people who are having occupational stress in a very high level, and if we analyze the dosha dominance, we can see that there will be rasa kshaya or rasa depletion symptoms. So this doshahara treatment is basically internal purification, as we have said. In a Shodhana level, it can be Vamana, Virechana, Vasti or Nasya. Vamana is the where I think that is familiar for the people. Vamana is where we induce vomiting. Virechana is where we give medicines and we induce purgation. Vasti is a medicated way of correcting medicines through anorectal method, and Nasya is nasal instillation of medicines. So in minor level of occupational stress issues or such level of stress issues, even small dosages of Nasya, which can be done at home, at the place where we are is also ideal. Without a treatment center approach, we can do pratimarsha nasya or mild dose of nasya to a person to manage the stress level also. So there are various supportive therapies also, the treatments which are not Shodhana in nature, but it is Shamana in nature. They are called like Shirodhara, Shiropiju, Dubana, Dumapana, Shirobasti, Talapudachil, etc. Here, Shirodhara is where we will be giving either oils or buttermilk or such type of medicated things which is selected to the head in a repeated oscillatory movement. Siropichu can be, we are giving external application of medicated oils through a cotton pad and we'll be applying through the vertex for a fixed duration of time, which is cooling in nature. Dupana is where we are fumigating with medicated drugs in the area where the patient lives. So the smell which we inhale, the air which we inhale will be having the medicine's smoke. So it is a sort of aromatherapy. Dhumapana is we are inhaling the medicated smoke through a wick in an alternative nostrils. We inhale to the one, we exhale to the other. So such type motion, we intake the medicated wicks smoke through the nostrils. So that is Dhumapana. So the other things are Shirovasti and Talapudachil, where in Talapudachil it's a Kerala tradition thing where we give the paste of medicines for the scalp and cover it with plantain leaves and everything for a fixed period of time. And Shirovasti will be giving a corrected level of oil in your head, which is collectively kept for a fixed period of time. So all this is the minimum level of treatment understanding which you require, where all these measures helps a person relax and helps the one person's brain act in a proper oriented attitude to reduce the stress. So dosha modulation is done through these measures. So each dosha modulation done will be determining how your brain works and how your body responds to the stress. The proper success key your attitude and maintain for your body and the mind. So Ayurveda measures are mainly aiming to help a person achieve that stage of happiness through body and the mind. So I think if we have any questions we can handle.
Okay, we have one question. Could you please explain the Shirapichu procedure once again?
Okay, Shiropichu is being usually done by taking medicated oils into a cotton pad, which is oils which have heated. We take it to the cotton pad and in a normal temperature, and the oil is being maintained. That is being applied into the vertex. So that is being fixed and maintained for a fixed duration of time. So that in Shirovasti it will be a higher column of oil. In Shiropiju it is only in a layer of cotton pad. That amount of oil only will be there, but that will be maintained say for half an hour or 45 minutes based on the age of the person.
Thank you. Let's go to the next question. In your course, will you analyze the effect of various subtle entities on the human psyche, like divine entities maybe?
In the course, Devabhastrya modality is not being more emphasized. Yuktibhastrya management or this course is mainly based on the Ayurveda psychiatry of Yuktibhastrya modality. Since the three are very wide, we will not be able to focus everything in one session. So this is Ayurveda psychiatrist medicine-oriented management is handled here.
Will you explain various kinds of breathing practices in psychiatry?
That is also a Sattvajas methodology where supportive measures of breathing measures are done. This pranayama measures are various one. Each pranayama has each implication on mental health issue. For anxiety, we'll be doing Nadi Shodhana. For if a person is depressed, the medicine, the pranayama which we do will be different. So if a person is having psychotic symptom, we will not be advising a few. For them, another one will be required. So that is also a detailed one. If required, it can be done. It can be explained.
Okay, let's go to the next question. What is the mechanism of Shirodhara? How does it affect the human body and the mind?
Shirudhara is actually a procedure where we will be pouring through a particular vessel. A wick is being placed, and it can be oil, it can be buttermilk, or any medicated water, which will be hanging over the head, and oscillatory it is being provided. And this actually creates a galvanic response in the skin, changes in circulation, and also at the same time in a dosha level there is this Shirodhara is basically regulating the vata and the pitta, because vata is very high, it doesn't have any control. So we are controlling that to a phase of activity through a regulated motion of the water being poured to the head repeatedly. Also, in a physiological level, circulatory changes will be there. Brain's circulation is improved. Also, skin-based galvanic responses will be also very high in Shirodhara.
So, what is a common treatment for alcohol abuse in Ayurveda?
Alcohol abuse, usually we need to do proper level of evaluation of body system. What is his acne? How is his digestion is there? And what are the reasons for the repeated alcohol craving? So if it is body based or the mind based. So if it is an craving based on habit or something, we'll have to give proper supportive psychotherapy measures. So motivational therapy that we used to give. And also body's craving is being corrected through purificatory measures, and withdrawal symptoms are corrected with the medicines which we give.
How do we cope with stress induced by a disease? A person is often sick and it causes stress. How can they cope with that?
A psychosomatic disorder where the somatic phase is very high, the physical ailment is very high, and along with that, the stress is there. In that condition, first, the influence of the stress, is it the one causing the somatic condition high, is to be evaluated. That may not be known to the patient. It is usually when the high level of depression is there, inflammatory response will be very high. So that kapha dominance will have to be corrected, and medicines has to be given to the patient with stress management and the physic management at single angle. That means we'll be given medicines which will be correcting the stress at the same time correcting the illness at the same time. And also relaxation methodologies will be advised to the patient so that he will be able to get rid of the fear of the disease.
Okay, so thank you for the valuable knowledge. Could you please tell how is it possible to treat the effects of subtle entities?
Is it the same question which we handled in the second one?
I don't know. It could be.
Like, am I asking, are they requiring regarding the Devapasraya modalities? Sattva entities? Is it that the question is?
Okay, I'll ask them to clarify the question. If we see it again, I will tell you. Is that okay? Okay.
Yeah, because it is a bit very lengthy area and a controversial area based on a person's belief to explain.
So The next question is, some breathing practices and exercises like pranayama are more available to us than a lot of procedures like panchakarma, for example. So this is why it would be useful for us to have more detailed information about pranayama in stress and diseases. Would that be possible during the course, for example?
If needed, it can be done in the last session where we will be concluding. I can set about 10 minutes. I think we have a last concluding session, right? At that
Yes.
time, I can keep aside a 10 minutes methodology for handling. But it is not under the psychiatry methodology, it is psychotherapist's purview. But still, I can handle it on that day. Last session, I shall do it.
Okay, so we have some request for Deva Vyapasha section. Just maybe some general words about this line of treatment.
Okay, I shall explain. There are methodologies. It's actually not practiced very much high in the current situations because genuine practitioners who adopt the Vipassana methods are very less. So, what we will be doing will be a person has a belief system. So, that belief system is the one which makes them more confident. It can be individual's personal growth attitude. So that determines that person's deva. We have two existence. One is the physical existence of the matter, and we have another dimensional existence of a waveform for each body. That is a physics concept which we have always learned. So that energy level of an individual's existence is being altered or modulated through these forms of Devapasya treatment.
Mhm.
So, how can we alter it? It can be through rituals, which makes us into a level like if we have a conceptual level of Indian philosophy, we have energies which are translated through the chakras. If it is Hindu philosophy, they have their own homas, acharas, everything which protects the body and energy. So each system has measures to purify this energy level. If such type of beliefs or acharas cannot be done by the person, how do we approach this energy body? That is also how what we do in meditation, dhyana, sankalpa, and also by the pranayama also we are modulating the same energy. So yoga is also a method which is in turn going in line with the Devapasya, where a person doesn't have such type of cultural background. I hope that is a very brief about regarding it. If I go, it will be very long. Is that okay?
Do you know about some kinds of tantric practices in psychiatric context?
There are various tantric practices which are being done even in Kerala, in India, in places where we do self protection and also protection to the person. But as I have mentioned, it is to be done by a person who is very well high level of meditative stage, high level of energy purity, who has proper level of upasana, brahmacharya, such type of qualities. A person with such qualities are very less. So we help the patients do few practices purify the energy body, which requires very less level of upasana. Because such persons are very less, and meeting them will be very difficult for the patient. Because that person who does the practice and his intention determines the result of the tantric practice. So that is why this base level of tantric practices got extended in later eras of modern phases. So we help patients do mild practices which are cleansing their energy level and doing self-protection. And one among them is the Dubana, which I had mentioned. So that is actually fumigation at the same time it is healing the energy field. So we prescribe medicines which can be added um, to the flame, and the smoke can be which is self purificatory for our system. and it is this level of self protection.
I think we've answered everything as of now, and our time is up. So you can say some few words if you'd like.
And this morning, the session was really a very attentive one, I think, because I think too many questions were there regarding the condition, how it is occurring. So, very best for each one of you for the online course if you're joining for that. And we'll meet in a discussion session. And I'll be handling a few things which you had inquired regarding this treat pranayama measures on the last session. All the best.
Okay, bye, Dr. Trishara. Thank you.
Namaste, and thank you for your proper and detailed translation. Meet you later on. Thank you.
Yeah, I tried to do so. Thank you. Namaste.
Namaste.